I think one of the main questions that often gets unanswered when patients go and see a lot of consults is if they have a nose where the tip itself is projected overly so, and they want real deprojection, they really want the tip to be set back, how is that done? How is that accomplished?
It's one of the harder things, again, to do in rhinoplasty, and a lot of surgeons don't have a lot of great experience with it or great results from doing it, and so they tend to neglect the projection issue of the tip in favor of focusing a lot more on reducing the bridge.
Yeah, a lot of patients who are overly projected will subsequently become revision patients who feel they've got sort of a Pinocchio effect where the bridge has been brought down but the tip wasn't truly adequately addressed. You know, it's one of the fundamental questions that we would say you have to ask the surgeon if that's one of your goals in getting deprojection with rhinoplasty. How do you accomplish this? And we would really say that doing this through an open approach is the only way to do that. A closed technique really doesn't give you a reliable method for that.
Yeah, through a closed technique you can't really address the tip directly in that way to deproject the tip structure. So instead, they focus a lot on shortening the septum, on taking away tissue behind the tip, hoping the tip's going to fall in closer to the face. Unfortunately, you give away a lot of control when you use that kind of technique. So it might work out, but in many cases, those patients will end up destabilizing the tip and end up requiring some revision in the future.
That's a really important point. If you cut down the septum, you're just as likely to over-shorten the nose, over-rotate, or just the opposite, fall forward and get a hanging columella. To get a real true deprojection, we would argue that it has to be done through an open approach, that the surgeon has to look at the tip cartilages themselves and make a real analysis of whether you need what's called a lateral crural overlay or a medial crural overlay or some combination thereof, along with oftentimes some defatting of the overlying soft tissue to allow that skin contraction to happen so that you can get a true deprojection. So if it's something you're looking for, don't be afraid to ask your surgeon how do they accomplish it.